Which is better, face shields or masks? This simulation shows how a face shield can reduce your exposure to virus by 96% when someone near you coughs. They cover your mouth, nose, and eyes, which face masks don't.
Dr. Adalja says cloth masks prevent you from spreading the virus, but he thinks face shields offer two-way protection.
Okay, so by now just about everyone is wearing face masks. Are you ready to switch to a shield? This is what some experts are promoting. So what should you do? In a recently published article in the Journal of the American Medical Association, Dr. Perencevich, an infectious disease physician, argued that a face shield could better reduce the transmission of infections as it covers your mouth, nose, and eyes from bacteria, liquid droplets, and aerosols. They also argue that face shields should be included as part of strategies to safely and significantly reduce transmission in a public setting. And now the debate is on. Which protective mask is better suited to prevent infection? So let's look at the pros and cons. Here's infectious disease expert Dr. Amesh Adalja to break down the pros and cons of each.
The only pro of a face mask is, yes, it does form a physical impediment to droplets that may emanate from your mouth when you're talking or when you're breathing. However, it hasn't been established yet that that decreases transmission of this virus. So there is this theoretical idea that it impedes the motion of droplets to come out of your mouth, and that may decrease transmission. The cons of them are the fact that they give people a false sense of security, and people use them as a substitute for social distancing and a substitute for not washing their hands. The other con is that people touch their face a lot more when they're wearing the mask. People with masks also don't often wash them as much as they need to wash them, and those masks themselves can be contaminated not only with the novel coronavirus but with other types of pathogens, and these are strewn around city streets and sidewalks, as well as in a person's house, where they may contaminate things secondarily because they're not washing or taking care of that mask. The pros of a face shield are that they cover not only your mouth and your nose, they cover your eyes as well, and you can be infected with the coronavirus through your eyes. So that is a benefit over and above a face mask. Another benefit is that they're translucent. You can see through them. They're less obstructive to your mouth and your nose, so they may be more comfortable to wear. The third is that they're reusable. You can clean them off and you can wear them again. Many people with face masks, for example, will throw them out. They'll fail to wash them because they're harder to wash. They need to be washed in a washing machine, for example, versus a face shield that can be washed with household detergent because it's basically just a plexiglass covering that you wear.
A 2014 cough simulation by the National Library of Medicine found a shield could reduce a user's viral exposure by 96% when worn within 18 inches of someone who's coughing.
Though face shields are open below and on the sides, I don't believe that that's a major risk for transmission. Remember that these respiratory droplets are likely to fall to the ground within 6 feet. They act under the action of gravity, so I don't think that there is much of a concern with the openings there. Actually, those openings may make them much more easier to wear, much more easier to comply with. And I would say the benefit of not touching your face and protecting your eyes probably outweighs any other deficiency that people might postulate about these face shields.
Which is better, face shields or masks? Health professionals wear them, so should you. NBC medical contributor Dr. Joseph Fair contracted coronavirus through his eyes during a flight. Face shields have other benefits compared to traditional masks. It's easier to communicate because your mouth isn't covered. And these plastic face shields can be disinfected using alcohol wipes or soap and water so they can be used over and over again.
But what's right for you, a mask or a face shield?
These face shields are definitely a different look and feel than the masks. For starters, it's a lot easier to talk and to breathe while wearing them, and I don't have to adjust it once I put it on. Plus, I can actually even drink while wearing it. And a bonus, the facial recognition on my phone works. But after wearing a mask for the past few months, it is a strange sensation to have so much open space underneath my chin and around the side of my face. When I wear a mask, you can see it covers my nose, my mouth, and my chin without any big gaps. The CDC recommends we wear face coverings like this because they capture our germs and prevent them from spreading to others.
So, which one is better? So far, no studies have been done to compare the two when it comes to COVID-19. But a 2014 study looked at how well face shields blocked flu droplets. Researchers used a cough simulator and found that face shields reduced a person's exposure to large cough droplets by 96%.